Good afternoon, everyone. I'm Shabira Papain. I'm COO of Best Beginnings. I'll introduce you to our panellists as it's their turn to speak, so you remember who's in front of you and who's speaking. Best Beginnings is a national charity. We're focused on giving every child the best start in life. In today's symposium, we're going to hear from our speakers and then we're going to have a panel discussion. And we've kept about 25 minutes for a discussion so we can have a dialogue with you and have any questions and explore anything that you feel you'd like to explore based on anything you've heard today. So each speaker will have 10 minutes and then Alison will join for the symposium conversation at the end. We're here today because we're really passionate about Baby Buddy. If you've met any of us before, you'll know that 10 minutes each speaker to talk about Baby Buddy is really not enough. We could speak to you all day. And so at the 9-minute mark for each speaker, I'll let them know they've only got 1 minute left. And for some, that's going to be much harder than for others. But we're going to keep it tight because we really do want to have a conversation with you. And we also believe that every child has the opportunity to reach their full potential. And what we're going to share with you today is how when you share accessible, evidence, national, quality assured, NHS accredited, in time information, which I'm going to talk to you about, and information that's at the palm of everyone's hands 24/7, you can support families who've got a little person with them, the babies that you're catching every day, to maximise their full potential. And I'm going to share a little story with you from my own life to illustrate how having in-time information can change the trajectory of that family. Now, we don't say that digital does itself. We know digital doesn't itself. We're suggesting to you that when you use a powerful resource like Baby Buddy and you integrate it into the care system, that can change the direction of that child's life. So I'm going to take you to Australia, 1989. I was 11 years old. I'd been living in Australia for about 4 years. And if you spoke to me, I was just like every other Aussie kid. By that time, I had my Australian accent and I spoke fluently in English. It was a Tuesday and we were all getting split into reading groups. You know, when you get split, you go off and your mates go over here and your girlfriend's over there, and we all got split into these reading groups. And it was like no other day. We'd been split into reading groups throughout the entire year. But on this day, I realised that all my friends were in other groups. And I was on the group where all the other kids, they spoke no English. No English. They had just come to Australia. And I was like, there has to be something wrong. Like, these kids don't speak English. I have to be in the wrong group. All my friends are over there, like Chelsea Angels in that group. That's the group I want to go to. So I left my group and I went back inside my class and I went to ask Mr. Simons, I think you've made a mistake because I'm clearly in the wrong group. And as I was about to tell him, Chelsea Angel had gone to Mr. Simons and she was saying, look, sir, my mum wants me to go on this accelerated program and she says I need to do some extra English. What else can I do? And he turned to her and he said, Chelsea, the best thing anyone can ever do is read. Just read loads, and that's your ticket to PIAC, which was the accelerated group. And I stood there and I thought, why didn't anyone ever tell me to read? Like, how come no one's told me that all I had to do was read? So I waited for her to finish with him and I went up to him and I said, sir, I think I'm in the wrong reading group. I'm with the Iraqi kids who don't speak English. And he said, no, Shabira, you're in the right group. And it dawned on me that I couldn't read and write properly. And no one had ever said a thing. But it was that in-time information. It was that moment in time that I overheard him say something to somebody else. And that in-time information, that changes the trajectory. Because we finished the term, we were on summer holidays, and I read that whole summer. Not only did I read, I couldn't understand what I was reading. I have to be really straight with you. I read the same book for 6 weeks. I had no idea what it said, but I kept reading it. And then one day, the story finally came together, and I was like, oh, I understand. I see the story in my head. Now, what has that story got to do with Baby Buddy? because Baby Buddy is that in-time information. It's not leaving it to chance. It's democratizing access to information. And that's the power. And that means that every contact that you have with families, you're not leaving it to chance. You're making every contact count, because in-time information can change everything. There is no point giving a mum, when she comes to you with everything else, you know, with overcrowding at home, with working 2 jobs, having another 2 kids. You don't know what her family life is like. There is no reason why now, with the technology that we have, that we leave it to chance when we give her a bag of leaflets. Then what, she has to rifle through to remember that one bit of information? What is preeclampsia? What is ICP? Using a tool like Baby Buddy that's been designed with families, for families, with professionals, for health professionals, means that we're optimizing that opportunity. And like the 11-year-old Shabira, who couldn't read and write properly and she didn't even know it, yeah, she had the walls to go up to a teacher and go, "Excuse me, sir, you've got me in the wrong group." It means you don't leave it to chance. You make every contact count. And what we're hoping to do in our symposium today is show you how you can do that. It's not magic, although it feels really magical when you're doing it, and hopefully Carly's going to share some of that with you later today. So there's the 11-year-old Shabira, who thought she was a whiz and had to spend her whole summer of 1989 reading a book that she didn't understand, but by the time she started school in February 1990, she knew what she was talking about. And on that note, I'm going to introduce you to Carly. Carly is our head of operations. She's a community development practitioner, and what she brings to Best Beginnings is over 10 years of experience of working with local families, particularly in East London, where we know that there is, you know, high poverty, where there's the seldom heard communities haven't got access always to information, and she works with her team to integrate Baby Buddy into community networks and into local care pathways.
Thank you. Thank you. Hello everyone. Hi. As Shabira said, I'm Carly Bond. I'm really excited to be here today, and I'm going to be discussing with you about how the app as a digital tool can be put into every midwife's toolkit as something that enhances conversations and reinforces messages that you already have to say on a daily basis. So we're going to start with showing a little video.
Are you a new parent or about to become one? Baby Buddy is the free award-winning mobile phone app for parents-to-be and new parents. Create your own personal baby expert who will guide you through your pregnancy and the first 6 months of your baby's life. Baby Buddy has been created with mums, midwives and doctors, so let them tell you more.
As soon as I wake up, I know that there's new information, so I just quickly click on it.
I can put the appointments in to help me remember that I've got to be at a certain place at a certain time.
Just not only track your progress of pregnancy, but also ask questions.
This app really is what I call the future of healthcare.
So what you can see from that demo is that Baby Buddy is a digital tool, that it's inclusive, that it's used by many parents, that the video and the resources in Baby Buddy have been co-created with parents, that it works and caters for those groups at risk of poor outcomes. So the app was created directly from the recommendations from Marmot's review, saying that to reduce inequalities, you create universal resources and then target those particular groups at risk of poor outcomes. So this is what Baby Buddy does. So it reaches out to seldom heard communities, to those not in education, employment and training, to young parents, to Black, Asian, minority, ethnic communities, seldom heard communities, to overcome that gap and reduce inequalities, to level that playing field. You know, as Shabira had mentioned previously about the endorsements that we have, it is endorsed by the Royal College of Midwives and lots of other Royal Colleges and leading organisations. It's won awards. I think, you know, what's important for you to bear in mind is we haven't had a PR budget for Baby Buddy at all. We're a charity, right? But we get 5,000 downloads a month. And what that works out to is approximately 10% of the national birth cohort. So we're doing this with no PR budget. Well, how are we getting those kind of downloads? Because we've just hit 250,000 users who have downloaded the app. How? By word of mouth. You'd be surprised how resourceful parents are who want digital tools, because we were told in the Better Births Review that is something that's really important. We were also mentioned in the Better Births Review as well. So it's really important that the Baby Buddy app was created as a direct result of what we have been hearing in consultation with parents and healthcare professionals to bridge that gap. Now, don't take my word for it. I can say to you, I can talk about Baby Buddy app every day, all day, every day, in work, out of work, on the street, on the tube. I've been known to give leaflets out. Why? I mean, you laugh. Why? Because this is powerful stuff. It's about health literacy. It's about access to information. It's about parents giving that great starting point for their children. And I had a good starting point because my mum was a natural caregiver. But for others who need a little bit more support, I feel that they should get it. And it's not necessarily a natural part as a national resource that people are going to get that evidence, consistent information in one place. So we know this is one way to redress. The particular outcome that I'm really interested in here around the impact, this is in-app feedback directly from parents. It's the one at the bottom that says that nearly 7,000 parents, 86% of them said that they feel that Baby Buddy app helps them get more out of their appointments, because what that means is it's helping them to prepare them and work more effectively with you to get the most out of their maternity journey. You know, so you can see the high numbers there. You can see that over 13,000 parents find the app easy to understand. So these are not small fry numbers. Here we are. So one of the most common questions that we hear out and in the community when we're training health visitors and midwives, of which we've trained thousands, is, well, you know, the app is, it discriminates against those who speak English as a second language because you haven't translated it into other languages, and why have you decided to be exclusive like that and leave them out? And I'm like, well, the data tells a different story. The data really does tell a different story. What you can see on the screen in front of you is that the red line is the ONS data. So that's the percentage of parents who speak that language across the country. And then overlapping that is that green line, which is the amount of Baby Buddy users who have been speaking these other community languages, and they overuse the app. So the data is telling us a different story, that actually people speaking English as a second language don't see the app being in English as a barrier. And that's because we've catered to them. The reading age of the app is 11. There's audio speak. If you tap on your Baby Buddy avatar, she talks. Now, what we found when we've gone and done outreach in Newham University Hospital is that on the ground, audio speak really helps for mums who are trying to build confidence, have a bit of English, understand more than they can speak. They love that, and they're using it, and they're finding it helpful. So that's one. And then the next one is around reach and impact. Now, what you can see from the slide on the left over here is you can see all UK users. So this, just to bear in mind as your baseline, is that normally an app would be used by someone approximately 30 times. So this is the amount of times the app has been used across the maternity journey for a parent for a parent. And you can see, so it's extremely high usage is over 250 times, yeah? And that's a quarter of users would use it over 250 times across their maternity journey. But if you speak English as a second language, 61% are using it more than 250 times. And in areas where we've been embedding and integrating the app into local care pathways, I mean, they use it so much. You know, and so you can really see here what the potential is, and that some of the presumptions that we might have about language actually get turned on their head when we look at the data slides. So I'm going to show you another video now, and this video is to do with ICP. What the video will highlight to you is that Baby Buddy has taken complex medical information, and because of the power of peer film to film, where you see a parent telling you about their experience and how they overcame it, that actually operates to distill complex information in a simplified way directly to a parent. So have a look.
Intrahepatic cholestasis of pregnancy, or ICP, is a dangerous liver disease that affects up to 5,500 women in the UK each year. You may also hear it called obstetric cholestasis, or OC. It usually starts in the later months of your pregnancy, but it can affect you at any time.
So we know that ICP can affect any mother in their pregnancy, in any pregnancy. But we also know that some mothers are more likely to get it, especially if your family origins are from India and Pakistan, or if you're having twins or triplets in that particular pregnancy. It can get really serious. We worry a lot about mothers, but also a lot about the babies, because it can cause stillbirth in babies, but also can cause babies to be born prematurely. When you have ICP, you tend to get a lot of itching. Now, itching can be normal in pregnancy. Sometimes mums can say that it's very specific to hands and feet. You can also get generalized itching everywhere else on the body. The main thing is that if you have itching at any point in your pregnancy, you need to see a midwife within 24 hours.
So what is my lasting thought to leave you with? Well, you've just seen a video around safety, the ICP video. What it shows you is that you've got ready-made videos and resources to be able to support and enhance your work as midwives, and enhance having difficult conversations with women, because you've got those complex information being given in a simplified way, which can start a challenging conversation with women that you're in appointments with. So my lasting thought that I leave you with is about Baby Buddy and the glue that it can be to enhance and deepen your practice with women. What I may say is that I can share two anecdotes. One is with an ANC midwife in Hillingdon, who gets women to download as part of their appointments, and then puts their appointments on and syncs it to their calendar with them. What she's found is that there has been a reduction in her do not attends as a result of using that feature within the app. So it talks. The other one I want to share is in Newham University. I was working with a midwife who's very much behind walking during pregnancy and keeping active and all the benefits of that. And so she saw the videos around walking with a bump, and she just was like, wow, this is great, I'm going to be able to use this straight away. And she favorited the videos so she could watch it on live and on offline, and literally that's off she went, and she started using it as part of her practice. So I really want to leave you with the thought that this is a ready-made resource that's evidence-based, co-created with parents and healthcare professionals. It's NHS accredited, and it's ready for you to use now with parents. So, you know, don't delay. Download after this, you know, especially those in the UK, you can literally download immediately, and you'll hear about the rest of the global platforms and plans to come.
Hi everyone, I'm Nicos Middleton from the Cyprus University of Technology. I'm going to transport you somewhere warmer. I just came from Cyprus last night and I'm freezing over here. I like that last slide, the glue. I'm going to spend some time talking about our experience bringing Baby Buddy forward to Cyprus. And Baby Buddy has been a glue in Cyprus in more than ways that you can imagine, because it's bringing the health professional community together and created in these last 2 years an interprofessional platform and dialogue on how we can use Baby Buddy to improve the health outcomes of Cypriot babies. So it was 2017, I think, when my team at the Department of Nursing at the Cyprus University of Technology and Birth Forward, which is a local NGO dedicated to improving the birth culture and the birth environment in Cyprus, came in contact with Best Beginnings. And that was not because of the lack of digital tools and resources with evidence-based information in the Greek language. that's not what made us contact Best Beginnings and see whether we can tap on this resource. What made us contact Best Beginnings was the fact that we sensed that pregnant women were not getting as much as they should out of their appointments in Cyprus. There was physician dominance in the conversations, and women were not participating as much as they should and they wanted. Actually, the data that came out of one of the research activities we built in Baby Buddy Cyprus confirms that, but in the interest of sticking to my 9 minutes, I pushed that slide to the end, and I might talk about it only if I have time. So a little bit more about the Cyprus context. We are a small country. We've got a birth cohort of about 10,000 births a year, a bit under 10,000. Somebody would say if there is a place where system change can happen, that might be Cyprus, but we're finding that the resistance to change is quite big, and it's not just about size. There's other problems about the birth environment and culture in Cyprus. We've got a very strong private sector. 70% of births happen in the private sector, so it's a bit fragmented, and it's split down socioeconomic lines. We have a very high cesarean rate. 60% of births are by cesarean, and we have quite a high rate of premature births, 12%. In both those stats, Cyprus is top of the ranks, especially for the cesarean, and top 10, I guess, for prematurity globally. As I already said, there is quite strong medicalization of birth and physician dominance in the communication. And I'm going to share with you some other data that come out of our research from our department. Women do not attend their antenatal classes. There's about 1 in 3 women that would participate in an antenatal class. We don't have any baby-friendly hospitals, even though some hospitals are making that transition now, and there is very fragmented practices in terms of supporting breastfeeding. Breastfeeding is very low, even within the first 48 hours after birth. There's been studies that recorded quite high percentage of postpartum depression, and women don't generally rate the experience of labor very high. So Baby Buddy Cyprus, Baby Buddy Forward, as we called the project 2 years ago, is an EU-funded project that forms a strategic partnership between the UK and Cyprus, and 2 more countries, Germany and Greece, we decided had to come along with us on this journey to learn from the experience and see how they can transfer this knowledge over to their settings. It's a cooperation for innovation, and so the best platform to receive funding to do that was the Erasmus Plus program, the Strategic Partnership for Innovation program. It's a 3-year project, and we are 2 years into the project. We wanted to create a version of Baby Buddy for Cyprus. And as part of that, we built in a lot of research exercises, as we called them, on how to get there. The first thing we wanted to do was to evaluate the cross-national relevance and transferability of the material in Baby Buddy, including and mainly, I'd say, the video material. And the second thing we wanted to do was to actually actively involve the health professional community locally and mums-to-be in Cyprus to talk about what they need and what do they think the priorities are in terms of content, in terms of topics, to see whether we can customize further the tool, this excellent resource, to address the real needs of local parents-to-be and the priorities as the health professionals are telling us. For someone that wants to know more about the process, babybuddyforward.com. When we started, we were 6 organizations over 4 countries. Now the family grew much bigger, and I'd say this is one of the biggest achievements right from the beginning. The fact that all relevant professional associations in the country have endorsed this this work. The Midwives Association, the Obstetrics, Pediatrics, Perinatal, and the National Committee for Breastfeeding are associated partners now in the project, and they're coming along in the journey with us to co-create Baby Buddy Cyprus, and this is great. So Baby Buddy platform is up and running in beta version, and we are in the stage of user testing it with a panel of parents in Cyprus and with our midwifery students back at the department before we move forward. He speaks 5 languages, not just Greek. English is there, Russian, Turkish, and Arabic to support the needs of those communities. And we kept most of the features of the original Baby Buddy. So there is the daily drip of information, there is the Ask Me, where someone can ask questions and get an answer, a glossary, and of course the video material. As I said, we build in lots of different activities in the process of how we're going to get from Baby Buddy forward into Baby Buddy Cyprus. And a lot of the knowledge came from of how to do it, came from Best Beginnings, and of course we based the whole process on the principles and values of Best Beginnings, which is co-creation using collective intelligence of parents and health professionals, and to increase the sense of, create the sense of co-ownership. This is for everyone. So right from the beginning, we had the active involvement of the local clinical health professional community, and of course the parents. And what we wanted to do was to evaluate what was already there and what we can use, but also talk to them and see what the needs are, what do they think are priorities, map that to the existing content so that we can decide what extra material we should be developing. I'm not going to talk more about the process. I'm just going to focus on 2 aspects of the process. Evaluating the material that was already there and how relevant it is to Cyprus, because I think that's informative, and then a little bit about the Delphi survey that we run with health professionals and parents to see what the local needs and priorities are and whether that is already included in Baby Buddy, and hence whether the resource is easily transferable from what we think is a much higher resource setting to a much lower resource setting. 1 minute. So video material, we evaluated with the help of health professionals and parents over 275 videos. I'm not going to talk a lot about the process, but 3 independent raters watched each video. If there was an obstetrician, the other one was a midwife, and the third person was the holder of the experience. So if it was prematurity, that was a family that had a premature baby. 74% of the videos were rated as highly relevant in terms of their content, in terms of the topic, to the Cyprus setting. That's 3/4 of the videos, which we're now transferring over with subtitles onto Baby Buddy Cyprus. There was a little bit of concern in terms of whether they were all suitable, and some were judged as less suitable for several reasons that pretty much, I'd say, the gist is that people found them very UK specific for things and services that we don't have over there, the differences in the healthcare system, or simply that the context in which it was presented, it wasn't exactly right. So the topic is right, but we need to refilm it so for people to be able to relate. So that's one message. The second message that comes out of the Delphi survey is that we brought people together right from the beginning, the midwives, the antenatal educators, the obstetricians. We sat around a table and we decided what should Baby Buddy include. They didn't know Baby Buddy. We wrote down 174 different topics, and we ran a big online Delphi survey where 500 people participated, 200 health professionals, 300 pregnant women. So we narrowed it down to what the priorities would be in Cyprus. Breastfeeding, prematurity, mental health were at the top of the list. A lot of videos in Baby Buddy on those topics. Then we had a second round of the Delphi, where within the context of a midwifery conference back in Cyprus, we asked the midwives to see how people voted and then re-rate those topics based on what people are telling us. So we came up with a final list, the top 34 topics, the top 101 topics. We mapped that to Baby Buddy, and 90% of the local needs and priorities in Cyprus were already there in Baby Buddy in some form or other, video or text. From the 101 top priorities, 80% was already in Baby Buddy. One might wonder what was not there. We can come back to that in the discussion. This process so far was amazing, and it was a huge, huge learning curve for us down in Cyprus. It was agent-led, academics, the university was leading this, and an NGO, but it brought people together, and we think it's going to have an impact in bringing system change top-down with better equipped midwives and health professionals to have a tool on their hands, and bottom-up because we're going to have better informed parents where they're going to go in a more and have this conversation in a more structured way. The biggest achievement, I'd say, of Baby Buddy Cyprus was that it created a platform for interprofessional collaboration. A midwife that joined our session said, I really enjoyed meeting everybody today, that we were asked, even the fact that a practicing midwife was there along the journey to tell us right from the beginning her experience of what she thinks people need, she felt was not something that happens very often. It makes us all better. Thank you very much. 700 people participated in the activities of Baby Buddy Cyprus so far, and we are excited that we are a few months before the big launch, 19th of March. Thank you.
Beautiful.
So my name's Adrienne Gordon. I'm a neonatologist from Australia, but originally from Scotland, hence the slightly mixed up accent. So I'm going to tell you about an exciting new project in Australia about safer pregnancy and stillbirth prevention, and what the plans are for using Baby Buddy as an implementation tool to support that, which is a national program. So this is about a program called the Safer Baby Bundle. What is the Safer Baby Bundle? So it's not a bundle of stuff, it's a bundle of education. So this is a national funded project in Australia. It's got 5 evidence-based elements, which are all about things that there is an evidence base, but there is a gap in getting that into practice. So in areas where we know lives can be saved or care can be improved, but there was already high uptake, like intrapartum management, that didn't make it into the bundle. So the things where there was a gap made it into the bundle. So each of these elements was something which, on a survey of practice in Australia, less than 50% had consistent policy on these aspects. So it includes smoking cessation, better detection and surveillance of fetal growth restriction, awareness and management of reduced fetal movements, awareness of side sleeping in late pregnancy, and tools to provide clinicians and women with better decision-making tools around timing of birth. And I'll go into each of these in a little bit more detail. But the goal of this program is to reduce stillbirth by 20% in late pregnancy by 2023. And so why do we actually need to focus on late pregnancy stillbirth? This is data from the Lancet series in 2016, looking at the rate of stillbirth by country on the right and the rate reduction on the left. So globally, 3.5 per thousand, 28 weeks and above, in terms of the stillbirth rate. In Australia, we've had a very small reduction. We are ranked 15th. If we got down to the rates of the countries which do well, so those countries down the bottom are mainly Scandinavian countries, Norway, Finland, public health care, less inequity, continuity of midwifery care. If we could do as well as those countries, we could get down to about less than 2 per thousand. And you can see there the UK there as well, obviously has been focusing on this for some time as well. So we know that bundles of care can save lives, and we know that through 2 a similar but slightly different bundles, there has been a 20% reduction in England. The Saving Babies' Lives bundle was reviewed in certain hospitals. In those hospitals, there was a 20% reduction. In Scotland, the Quality Improvement Initiative has led to a similar reduction, but for the country. We launched this in Australia on the 15th of October. For the midwives in the room, I think you would know the significance of that date. It's International Pregnancy and Infant Loss Day. For people who want to go and look at these resources, they are freely available for clinicians. That is the website there. They're CPD accredited by our colleges in Australia. And they're designed for use on all mobile devices. These are the clinician resources. And what we're hoping to do, and are on the way to do, is to enhance these clinician resources with Baby Buddy Australia to make sure that this translates to information in the hands of women. So at the moment, those clinician resources that were launched are on all mobile devices. There's case studies, which clinicians are very used to using for learning. And there are videos and tools like posters and flowcharts that people can use in their practice. So what we are doing is co-creating Baby Buddy Australia, initially very focused on these components of the Safer Baby Bundle, because that's where our funding has come from, although we're absolutely aware that it's a much broader resource than that, but this is a great place to start in terms of a national initiative. We want to co-create Baby Buddy Australia to empower women. We're building on some of the resources that are within the app already. 25 films in the app were focused on improving outcomes, reducing stillbirth and maternal mortality through something called the Our Chance Initiative, which was a collaborative with Best Beginnings, NHS England and SANS a few years ago. So 25 films in there already, which are perfectly aligned to the sort of information we need for the Safer Baby Bundle. For each of the elements, I'm just going to give you a quick glimpse of the sort of existing content there is, and for the elements that we're going to have to create new and Australia-specific content. So first of all, initiatives to help prevent smoking in pregnancy. There are lots of videos on this in the app already. And for those of you who don't have the app, I encourage you to go in, look at this. You can look at videos, go to categories, go to antenatal care, search for smoking. You can find this in all sorts of different ways. So there are video content in there already. There's also some goal setting and specific advice and Q&A about smoking. And you can set yourself goals about cutting down or quitting or appointments for that particular component. In terms of fetal growth restriction, there is some information in the app already around is my baby growing, what you can expect to happen at your visit with your midwife. And that complements the sort of information we have in these clinician tools. So we're hoping this will reflect back and forward for the information for clinicians and for women. In terms of movements, there's a lot of content in Baby Buddy already about what movements are normal, when you should start to feel them. So very nice peer-to-peer information about a couple who are a young parents talking to each other about what's normal and when you start feeling the baby, as well as the important things of what to do if you feel this is not normal for you. We have created, through focus groups and surveys across the country in Australia, some information around movements that is in line with the national policy. So the content within Baby Buddy app will be absolutely informed by what we've done locally with movements. We've also run a very large trial called the My Baby's Movements trial, which had its own freestanding app. And the learnings that we've got from that trial of about 250,000 women will again be incorporated into Baby Buddy Australia. In terms of sleep position, a very translatable advice about going to sleep on your side, either left or right in late pregnancy, may halve the risk of stillbirth. We know that there is double the risk of stillbirth in studies that look at that particular risk factor. Very modifiable information needs to be in the hands of women. And again, we've got mixed methods work in Australia that has created content with Aboriginal mums about, what's the right message in terms of sleeping on the side. So all of that will come back and enhance what is already in Baby Buddy. But for one of the elements, we really need to create new resources. And this will also benefit Baby Buddy UK, and this is around decision-making around timing of birth. And we heard the comment in the plenary this morning about induction at 39 weeks, and it's obviously very pertinent to midwives. It's quite controversial, but these decisions are being had all the time. In countries with a 60% caesarean rate, it's contributing to the 12% prematurity rate, and ways to actually get information in a balanced way, delivered in a balanced way, is a challenge. So we have some resources already in Australia through an initiative called Every Week Counts, which are going to be incorporated into Baby Buddy Australia. And you can see here on the right is our first workshop. We have some maternity care workers there who work up in Cape York, which is very remote in Australia. They're very keen to have resources that are in the hands of women where they actually are, say, 700 to 1,000 kilometres from a healthcare facility. We also have Indigenous reference groups that are aligned with our Stillbirth Prevention Initiative. And Loretta there on the left is a PhD student who's been working with Baby Buddy for some time. So this is just some of the quotes from that first workshop. And I need to put my glasses on to read this, actually. It's slightly embarrassing. Okay, so yes, most of the video content, and this is very similar to what Nicos was saying, most of it is relevant and suitable with minor adaptation. So the comments that we got are really around about setting. They're not around whether the people are the wrong people or the information is the wrong information. It's about, could the nurse not be wearing an NHS uniform, for example. So these are very minor, easy to make changes. Love the app, Just What Australia Needs. That we like that one, we popped that in. And I don't think there's a problem with accents. So people were concerned that, you know, in Australia, there's such a wealth of accents in the UK, and in Australia, you just get like more slow. You don't necessarily have these very different accents. So there were some concerns around that, but it's very multicultural countries, that was not felt to be a problem. So that's some of our early feedback. And our plans are to launch the beta version, so similar to Cyprus, to launch the beta version at this conference in October 2020. It's just after Pregnancy Loss Week, and we're hoping to showcase Baby Buddy Australia in line with that Safer Baby Bundle program as the first phase at this conference next year, which we'd be delighted to receive people to.
At this stage, I just want to formally introduce to you our CEO and founder of Best Beginnings, Alison Baum. Alison is a biologist by background. She's a mum of two. She's a filmmaker. She's a pioneer. She is the one forging ahead, and we're trying to catch up to her all the while. And actually, if she had been presenting, she would have been just like Nicos. She wouldn't have been able to keep to the 10 minutes. So we had to slot her into the panel to make sure that we'd have opportunity for conversation. So welcome to the panel, Alison. So you will hear from Alison. So I'm going to take my prerogative as chair to kick off the questions. I hope you're harbouring some questions and you're getting ready to ask our panellists some challenging and probing questions. But I'm going to kick off with Carly. If I'm a midwife and I'm in Newham and I have these parents coming in all the time, and we know there's high rate of Romanian families moving in Newham, and I say, yep, great, I'm glad you showed me the data, but maybe those mums that are using your app, they have a little bit of English. My mums have no English. I've got this Romanian mum. How am I supposed to use the app with this mum?
And so what I would say to that is we've been carrying out outreach in antenatal settings in Newham, and the way that we're overcoming that bridge is by remembering that you've got over 300 videos in the app, and they're all picture based because they're videos, right? So there's some, for instance, with breastfeeding, which funnily enough was our most popular post on social media, was around breastfeeding positioning. It doesn't need any words. It shows you just by looking at the video without any words. The idea of a picture showing 1,000 words is kind of accurate in this way. Also, the video I mentioned before about walking with bump, that normalizes just by seeing that picture. You don't need the words. So what I would say is that encouraging dialogue can really help, because what we found on the ground was with some mums, they would say they had no English, they had a tiny bit, but they weren't confident confident to speak the English, but they could understand a little bit. And so there was an element of showing features and then negotiating with mum a little bit around that. And then saying, okay, well, you've got your Romanian app here, but Baby Buddy's built towards our navigating our system. So there's ways that it can still help you. And so it was just about sharing that information, signposting, empowering, because, you know, our vision is that mums are able to say a few key words like baby, no, move. And that is enough to get them the urgent help that they need at that point. It's not necessarily to have to be able to articulate extremely in the English language. It's more about needing to say the right thing at the right time. So I would say there's ways and means. I have seen it, the app work as a tool for promoting conversations, even in ESOL groups in South London with an organisation called PACT. And it helped to overcome some of the stigma around mental health issues just by watching a mum. So there's power in it. We need to explore more how it can be used as a learning aid, perhaps. But yeah, the advice on the ground shows us that quite a lot of things are possible with the resource.
Thank you. Do you want to pass it over to Adrienne? So Adrienne's come all the way from Australia. And before we have to fly back, and we're really sorry for those of you that are freezing, we really appreciate you staying in here. We're just as cold as you. And so you've both come from warm places, and we're just showing you what Britain's really about. So you've come all the way from Australia. Before you jet off and you go, and it was really nice to hear about Baby Buddy Australia and the Stillbirth Bundle, but what bit of information do you want to make sure that we have here in the room, and those of us who are watching it through streaming, what bit of information you like, make sure you don't forget this?
So I think first of all, I would say, I think if you're in the UK, you don't know how lucky you are having this resource to share in your practice. So I think, you know, that's amazing and it's free. But I think what I would really like to highlight is we do have some evidence that this improves health outcomes. So on your tables, there is an A4 piece of paper which shows some recent data on uptake of breastfeeding and duration of breastfeeding improved in Baby Buddy users through something called the Babel study. So I think that is really important. So not only is this taken up and used more, but that increased use seems to translate into better health outcomes. And if we can just improve breastfeeding, that offers benefits, obviously, globally. So I think that's my message.
Okay, beautiful. Pass over to Alison. All right, Alison, there are loads of apps. I'm a midwife. The mums, every time they come in, they've got another app. There's
one that compares it to vegetables.
The one that compares it to vegetables, one compares it to fruit. There's loads of apps. And women are using Google. Why should they use Baby Buddy? Why your app?
First of all, it's not my app, it's our app. Some people have said it's almost like a national treasure here in the UK because it was created collaboratively with parents and multidisciplinary professionals. It was created to directly inform and empower you. So if I'm talking to a mum, this app is for you. It's like your digital best friend. You get to choose what your buddy looks like, everything from her hairstyle to her handbag. It feels peer-to-peer. It is peer-to-peer. But unlike what you sometimes hear from your friends or on the web, you can trust what you read in it, because every film and every bit of written information has gone through our editorial board and is quality assured. So it's that idea that here is a free app, an advert-free, that can give you the knowledge and confidence to look after your mental health and your physical health, and to help you maximize your baby's potential.
Beautiful. Okay, Nicos, this is my last question, then I promise I'm going to give it to you. This has come from conversations with some of the delegates who came to our stand, particularly those who are not in the UK and not in countries where, like us, we're so lucky to have midwifery-led units, for example. So could you just share a little bit about how you've used the opportunity of having Baby Buddy to give midwives more power and more of a voice in the Cypriot health system?
All right. So I'll have 1 minute for this.
45 seconds.
The experience, it was a huge learning curve for us as well. Bringing so many people together to sit at the same table, around the same table, and find a way forward and in fact give the midwives a voice in a country where they don't have as strong a voice as here. I'd say if this was coming from the Ministry of Health itself, it wouldn't have happened the same way. People would have felt that somebody was giving them orders. If it was coming from the midwives themselves exclusively, I'd say you wouldn't have had the same success, because then they wouldn't have all the physicians around the table. I'd say the fact that this was university-led helped a lot, because it created a safe environment where people would sit around the table, and the university was coordinating this effort. But in this way, it legitimized the role of the midwives as an equal partner in a country with 60% cesarean rates and no midwifery-led care.
Wonderful. Okay, so it's over to you. Katerina's got a microphone, yes?
Adrienne, I hate to come all this way and ask an Australian-specific question, but I just wonder, when you say you're going to launch it in Brisbane next year, or later this year, does that so what aspects of the app will be available in Australia or in Cyprus where you've got a modified version of it? What other aspects of the UK app are then available?
So the aim for Australia is that all the pregnancy content of the app will be available, and the content that relates to the 5 bundle elements will be enhanced, and the pregnancy content will all be made Australia specific, so in line with the pregnancy care guidelines. So there's quite a lot of work to do to make sure that all of those things are aligned, and the definitions and everything are aligned to Australia, but that's why it will take that year. But not the postnatal at this point, unless we get extra funding.
So just to add to that, I think one of the reasons we were very excited about doing a project like Baby Buddy Cyprus or Baby Buddy Australia is we see in order for us to really address inequalities and to address those outcomes, we need to create information that's seen as a whole, because as a family going through, you might not be thinking about stillbirth, or you might not be thinking about mental health. It's about that in-time information again. And so although the focus for Australia and the funding is on stillbirth, the families will get their whole content with the stillbirth content sitting within it. So it's a holistic approach. So all the antenatal content, that journey that parents have, that, on day 3, they might get, your baby's the size of, this, and this is what your baby will be doing. You would still get that, but with a particular focus, a little glance towards making sure that every family has in-time information to ensure that we reduce that risk of stillbirth. Yep, any other questions? Okay, 1, 2, and then 3.
Hello. In terms of providing information for the whole family, do you have any ways that you promote Baby Buddy app to partners, to mother-in-laws who have such a critical role on things like, from where I'm coming from, breastfeeding success and those kind of aspects?
Let's answer that one in 2 questions. So let's answer how we're doing it right now and how we envision doing that in maybe 6 months or in a year's time. So do you want to take how are we doing it now?
Yeah. So currently, Baby Buddy is primarily for mums. And we have been planning since 2010 to create the version for the dad, the partner, the auntie, the big sister, the mother, the kind of the family approach. Funding has been our rate limiting factor. But because it had always been our intention to create the version for the whole family, at download, we capture information of who is using Baby Buddy. And despite how mother-focused this current version is, we have had more than 7% of the users are fathers. So we've had more than 15,000 fathers downloading and using Baby Buddy. What's interesting, Carly mentioned some of the in-app data. She showed some feedback data. When we look at the data from fathers, that was mother data that was shared before. The fathers who are using Baby Buddy find it every bit as useful as the mothers. So there is unequivocally this enormous need to engage the whole family. That old adage, it takes a village to raise a child. So our plan is to create the new version of Baby Buddy, which will be for the whole family. And we are going to be getting underway with that work, and depending on funding, the aim is that by early 2021, that version will be ready for launch. But in advance of that, because co-creation underpins everything that we do, we'll be reaching out through many of our networks and would love to involve as many of you as would like to join our parent panel, our family panel, to make sure that the tone and the content really supports different family members to help joint decision making and to support the couple relationship.
Yeah, I think it's really important at this point, whether mums and dads or partners are together or not, it's really important. And so we want to make sure that Baby Buddy and the new version of Baby supports the kind of families that we're part of and not the one that we imagine everybody is in. And so whether a mum is with the dad or not, it's really important, and it's, from a child's perspective, it's their right that both parents have access to information. So it's not just about supporting that couple relationship, it's making sure that that everyone in the family who wants every child to reach their full potential has access to that evidence-based in-time information so they can make well-informed choices. So we had, yeah. They've given us a bit more time, yes.
Hello, my name is Catherine Williams, and I'm an English service user advocate and evidence enthusiast. So really it was a gentle point, which is around the Saving Babies' Lives Care Bundle, certainly in the UK, and I've just been reading Alexander Hazel's comments in the evaluation. We don't know that there's a causal link with the reduction in stillbirth. It's certainly very interesting, but from an evidential point of view, it isn't proved yet, and that's really important. I'm absolutely a fan of the Baby Buddy app. No, Alison and Shabira, lovely to see you today, and nice to meet Carly as well. Hello, that was a lovely presentation. So yeah, some really important work going on, but I guess almost just a hint of concern from me around shaping it to the clinical care bundle like that, rather than keeping it more general. I hear what you're saying about all the other information will be in there, but when we're at the stage we're at with the evidence, it's interesting. I can see the merit in it because the elements individually, in public health terms, are important, but there is this tendency in public policy, we see it in the UK, to have a very narrow focus on what safety means, a very narrow clinical focus. So my immediate question is, where, given the Australian birthplace study is just out, where is the evidence on midwifery units and that sort of thing?
Yeah, so no, I totally hear you. So obviously in 10 minutes there was not enough time to go into that. So that 20% reduction, I never said that was causal, and that's from the Widows paper evaluation in the hospitals that they chose as research sites, where only 42% of practicing people in those sites had even heard of the Saving Babies' Lives bundle. So that, as I mentioned, is not for the country. The Scottish data is for the country. The England and Wales data is from Alex's evaluation. He's very much part of the team who have got the funding for the Safer Baby bundle for Australia. So what didn't happen in England and Wales, and happened more in Scotland because it was through quality and safety, was an implementation plan. So the Saving Babies' Lives bundle was, in that white paper, but there was not an actual implementation plan in terms of the resources given to people, clinical champions in each site going through those resources. And that's why we've spent 2 years in Australia creating these e-learning tools that were launched on the 15th of October. That's because of a lot of work with the people here to see actually what would you need to make this stuff possible. So, and because of the interest and the funding, that's how we've got the funding for Baby Buddy Australia. But as I said to Kate, it would be all of the pregnancy components. So would all of the pregnancy part of the app would be adapted to be Australia context specific. It's just that those particular elements, the content needs to be identical to the content in the clinician resources developed for the bundle. So that's why we're focusing on those bits for that presentation, but it will be the whole pregnancy part of the app, because we absolutely recognise that it's not a single tool, and we've learnt that very strongly through the My Babies Movements trial, that a single tool for a single behaviour is not enough.
Yep. Are there any other questions? Yes, these two. We've got time. We've been given, sorry I should have said, we've been given a few extra minutes of time to stay in the cold room that we're enjoying.
Got my big
Oh, we should have shared.
So I'm okay. Carly, I was wondering if you could just talk a little bit more about what strategies you're using in the community to try and encourage use of the app.
Yeah, so one way is to obviously share the evidence base and why women might want to use that app over other apps that is NHS accredited. The quality assurance element, because you know, lots of women use lots of different apps. Why choose this app? So we talk about that. But the most important way as a healthcare professional, or even as a community development worker like ours, is to engage by just show what it does. Like the strategy is that when you show how it can support and help parents and enhance, when they see the videos and then they realise, right, they've made like over 300 videos for us. It stands on its own. When you put in an appointment and then it syncs to your calendar and sets you a reminder for the day before, so if you're feeling a bit forgetful, you can make sure you've done your preparation questions and looked into things. It really shows how it can enhance for parents, and they're always very bowled over. And then the last part I have to talk about is this. I have to talk about this little avatar because she's wearing a hijab. And so we know about representation in film and on TVs, and we've made a point of being inclusive. So you see diversity, and for lots of our users, they would have never seen an avatar of a woman wearing a hijab before, and they're just bowled over by it because they're seeing themselves. So with all of those messages, and once women get using, and they particularly love today's information, once they they get addicted to it, and they realise the value of it, and that they're being almost held in this relationship with this avatar and the baby buddy expert. So, yeah.
So strategically as an organisation, because we said at the beginning, digital doesn't do itself. What that means is the app is freely available on the App Store. It's not going to jump out and, you know, we don't have a marketing or PR budget. It's not going to jump out and going to change lives. What changes is the three phases in which we work at. So we work at influencing policy and practice. So we work with policymakers and service providers and shapers to ensure that we're part of that voice and take women's voice to that space. We work with frontline professionals like yourselves, and the next bit is the community networks. So Carly's team work with those frontline professionals and community practitioners. That means the peer-to-peer supporters. That means grassroots organisations. It means children's centres. It means libraries. It means wherever people are at, we're going to it, schools. And we're training both those midwives and health visitors and children's centre staffs, and we're training the peer supporters, the volunteers, those small voluntary sector organisations that are completely vital because they're seeing who the rest of us don't see. And we're training them. So Carly and her team go down there. We've got 2 community development practitioners actually supporting the integration of Baby Buddy, Marcia and Tara over there. And they're going and they're just working with those peer-to-peer supporters. And they're going there every week, week in, week out. And we get funded through trusts and foundations mostly for that work to make sure that everybody's got Baby Buddy. Because why should those grassroots organisations be creating their own digital platform? They shouldn't. It's there, it's really available for them, and so we work with them so that informs what they're already doing, and they've got this. Yeah? There was another question, it was Julie.
Sorry. Mine was a different angle. I just wanted to check, you were saying that the baby buddy went up to sort of the baby being 6 months old. And from my personal experience, I'd love to have had it when I had my child because I hadn't realised I had a bit of postnatal depression after. I just lost my father and I was pregnant, so I was really happy. And I beat myself up so much. I had a problem with breastfeeding. And I think what I didn't know until about a year later is I had postnatal depression. And if somebody had just said that to me, I would have had such a nicer time and enjoyed my baby so much more. And I just want to check and see how, if they use it, can they ask questions in the app to say, am I feeling right, am I not? I just want to check how that happened. Thank you.
I'll take that one. Thank you. So the first thing to say is it does currently only go to 6 months, but we are committed to taking Baby Buddy to the 5th birthday. So it will take us more years till 2021, but we're really clear that parents need support all the way through. It's about helping more children arrive at school ready to learn, but also emotionally able to get the most out of school and relationships for life. In terms of the maternal mental health, so there are over 70 films in Baby Buddy that support maternal mental health. We are so proud of this whole kind of subset of films within Baby Buddy. I want to take a moment to thank all the parents from around the UK who let our cameras into their lives, because they shared their stories to give other people the confidence to seek help when they need it. So there are films that you will get to see as part of the daily information, and there are many others that you can search for. And those films that are parent-led are supported by films from healthcare professionals. So in a nutshell, from a mental health perspective, Baby Buddy is there to give parents the confidence to seek help if they need it, and to know that it's okay not to be okay.
That's a good question to end on. I'm sorry if you've got any more questions, come and talk to us at the stand upstairs. I'm going to share with you, these are the take-home messages. We want you to, and especially those of you not in the room, Baby Buddy is freely available across the UK, and it's advert-free. It's valued by families of all backgrounds. That's really important. You know, particularly those of us who've come from a community development perspective, we've came to Best Beginnings and we've come to Baby Buddy because we could see that it was a cost-effective way of making sure that those communities who are most at risk of poor outcomes have access to information. It can improve health outcomes and early years outcomes as we extend the app, and it can be adapted for use in other countries. I'm going to end with one quote that was sent through by Jake. He's our product owner. I've just done something weird to the phone. Here we go. Ready? This is a quote from a mum. I'm just going to change the baby's name to my daughter's name to keep her anonymous. Hi there. I would like to thank you for staying by my side during this period. Your help has been amazing. I was one step closer to falling into depression, but with your help, I was able to pull through. Your daily messages of encouragement and information on how to care for Madeleine has made this whole journey worthwhile. I cannot thank you enough. Saying goodbye today breaks my heart. As I have had this app as my friend every morning, I receive a notification from you guys and used to bring me comfort when I felt so alone. Thank you. Lots of love, Mum of Madeleine. These are messages we're getting all the time. Like this is as simple as this. The daily information that feels like it might not be, it's that in-time information that I shared with you at the beginning. It's very cogent. It's been really carefully created so that you think, oh my God, how do they know I was feeling like that today? And that's the power of why digital can maximize every contact count when you're, as practitioners, using it on the ground. So we want to thank you